Good afternoon again, everyone. My name is Emily Herzog, and I'm an Epic Pathways Program Coordinator here in the Office of Health Equity and Inclusion at the University of Michigan School of Nursing. Thank you again for being here today. Before I hand things off to our moderator, I want to share our Winter 2024 Health Equity Leadership Series lineup. This used to feel forever away. I don't know about you all when I talked about these, and now they're right around the corner. But that's good. We have really great topics and speakers to look forward to. In the new year, we'll be welcoming Dr. Shirley Stevenson, who's a clinical practice nurse educator at UIC. We were just talking, Dr. Patil and Dr. Kittiteerasack about this, at the University of Illinois Chicago College of Nursing. Also a family nurse practitioner at UI Health, and super cool poet in residence at UIC's new Institute of Addiction and Mental Health. Just as Dr. Martin Luther King Jr. called upon us to discover our shared humanity, Ms. Stevenson will call upon us to rediscover the humanity of nursing, specifically as a means to care for, sustain, and express oneself as a nurse. It's a different kind of topic, but we are so excited to hear from Ms. Stevenson, and it'll be a really great presentation. If you haven't already registered, I'm about to put the link in the chat for all of you. And then I also wanted to mention, and if today's topic of LGBTQ plus health is of particular interest to you, specifically our University of Michigan faculty, staff, and students, we invite you to join us at our next DEI and Wellness Workshop on November 27th from 3:30 to 5 o'clock in room 2250, when we'll be learning more about what contributes to and perpetuates health disparities, implicit and explicit biases that exist within healthcare settings and care, how to implement inclusive care practices and interrupt harm, and ways to work towards closing the LGBTQ plus health disparity gap. We'll be welcoming the Spectrum Center. So the link for that, if you want to join us, again, this is open to all U of M faculty, staff, and students. Alrighty, then it's my honor now to introduce our moderator, Dr. Crystal Patil. Dr. Patil is a professor in the Department of Health, Behavior, and Biological Sciences and the Associate Dean for Research and Rackham Graduate Studies here at the University of Michigan School of Nursing. We're so grateful to have her joining us here today. Welcome, Dr. Patil.
Yes, thank you so much. And it's a pleasure to be here. Thank you all for joining us. Today's Health Equity Leadership Series is going to feature Dr. Priyoth Kittiteerasack. I'm going to call him Dr. K for short. And I just wanted to let you know that Dr. K is an assistant professor in the Department of Mental Health and Psychiatric Nursing. He's on faculty of nursing at Thammasat University in Thailand. He is also serving as head of the research unit in health, educational, and social equity and sexual and gender diversity. He has more than 10 years of experience in teaching, research, and leadership in nursing, and his research focuses on mental health disparities, especially depression and suicide among multicultural, sexual, and gender minority individuals in Asia and beyond. I also wanted to reiterate that his research in LGBTQ plus health is unique. This is an area that's understudied in nursing, and this is especially true for nursing outside of the Western or global North health systems or institutions, excuse me. So his contributions are so valuable, and this is not just for improving nursing care for LGBTQ plus people, but for raising the visibility of the unique needs and issues in Asia. So it is my pleasure to welcome Dr. K, and please join me in doing so.
Thank you so much, Dr. Crystal. So thank you for the nice introduction, and hello everyone, hello Michigan, and hello all colleagues and students. First of all, I would like to thank you, the School of Nursing, University of Michigan, for inviting me to share the experience of LGBT research in Thailand, and also thank you, Dean Patricia for these events. Thank you, Dr. Charles, and thank you, Emily, and all colleagues from the University of Michigan who worked with me for a while to create this wonderful sharing session. So as Dr. Patil said, I will share my research experiences and the way that I work with LGBT people in Thailand. So the topic that I'm going to talk today is about LGBT life in Thailand, past, current, and future situation. So we're going to have like around 30 minutes for sharing, right? And then we're going to have a Q&A for 20 minutes. So let me start. And I'm going to skip this one because Dr. Parshi introduced me already. So as we know, once we have to talk about LGBT, we have to learn more or know more. Also, okay, I'm gonna share by this. I think it's gonna be better. Okay, so we have to know more about the basics of those sex and gender before we get to know LGBT and what is LGBT, right? So in Thailand, normally in the past, we know only about sex. Yeah, and in the term sex, it can interpret cover both sex and gender in English. So that's why in Thailand, people quite confused when we talk about sex. So because it can mean sex in that real meaning, and also it can be a gender at the same time. So at that time, people a little bit confused and may not understand well what is LGBT, because if we see the people who have a gender that differs from their sex, biological sex, they call them as a third gender. So it creates a lot of confusion about that. But I'm gonna talk about this in general. So sex is the biological termination that we identify the people into female and male, right? Based on their chromosome, based on genital organ, and based on hormone. How about gender? Is culturally defined, depend on you are woman or men. So if you are a woman, you have role and responsibility about carrying service job, and you may have like a fragile in emotional way. But if you are a man, you are the roles and responsibility can be like a more in the masculine way, right? Construction, defenses, and your attribute going to be risk taking or aggressive, like a behavior, something like that. So this is a thing that a basic fundamental about sex and gender. But in real life, people do not match only in this both category at in the same way. We still have some of the people who are out of the box, not belonging into this female or male or men and women. And that is why we have to learn more about the sexual and gender minority. So I want to show you the genderbread. It can explain well what is sexual and gender minority and LGBT terms that we always use this term a lot in the research today. So this genderbread show you 4 dimensions of sexual and gender dimension. The first one is gender identity. The second one is sexual orientation. Third one is the biological sex. And the first one is gender expression. So we're gonna start with the first one. First one is biological sex. The biological sex is the in the structural and functional characteristics of a person who organism that Allah assign as either male, female, or intersex. It's assigned you once you was born, right? You was born as male, female. If you have that organ, or if you have both organ, you can be intersex. So for the biological sex, that's why if you want to know what is the biological sex of some people, you can ask what is your sex assigned at birth, right? And yeah, you can get the response by the female, I am a female, I am a male, or I am an intersex. So that is biological sex. How about gender identity? Gender identity is the sense of a person as being, they feel themselves as they are a man, a woman, or neither. So regardless of the biological sex, people can feel in different way. it doesn't mean that people have to feel belonging to their biological sex. So that's why in the gender identity, we always ask the people like, in your head, how you define your gender. If I'm born as a male, I feel like I am a man. So my gender identity is cisgender, right? But if I'm born as a male, and I feel like I am a woman, so I can be a transgender. So that's why gender identity can be matched or maybe not matched with the biological sex based on the sexual preference or gender preference that people like. The third one is about sexual orientation. Sexual orientation belong to your heart, not your organ, not genital organ, not your brain that you think, but it's belong to your heart. How do you feel? How do you feel have a sexual romantic attraction with someone? Yeah, so if you have sexual orientation like heterosexual, it means you're falling in love with the people who have a different sex with you, right? So, but if you feel like you're attracted to someone who have the same sex with you, we can identify you as a homosexual. So in this sexual orientation, we can categorize people into subtype of the sexual orientation. For example, heterosexual. If you fall in love with the people who has opposite sex with you, if you fall in love with the people of the same sex with you, you can be the heterosexual. Or if you fall in love with the people who have more than one sex, it can be a bisexual. Okay. So again, this part is linked to your feeling, not linked to your sexual organ or your gender identity. And the fourth one is gender expression. What is gender expression? Is the way that people express themselves through actions, to dress, to behavior, how you show others about your gender norm, to your gender preference. So like someone can express themselves in a feminine way or masculine way, right? So that is a gender expression. The important thing that we know about the genderbread is all dimension, this 4 dimension is completely separate to each other, and is no need to have to be linked, and it can change all the time. So people who are LGBT, there, as you know, if you are LGBT, it means you have sexual orientation and gender identity that different from social norm, as I mentioned before, right? If you have if your sexual and gender are in the social norm, you should be a heterosexual, like cisgender, that you feel like you're born as a male, you feel like a man, right? Or fall in love with the opposite sex. But for people who have a different sexual norm, so we call them as a sexual minority, and sometimes we call them as LGBT at the short term. Based on the Gallup poll, they say that in the US right now in 2003, is estimated that 7.2% of the American population are LGBT right now. And again, sexual orientation, gender identity, and biological sex are totally separate to each other. Gender identity and gender expression are not linked to sexual or romantic attraction, right? Sometimes in Thailand it's quite confused, and they always put LGBT people or people in the same box. For example, if they say someone who act out like in the way of gender expression in the feminine way, they always thought that these people should be gay or transgender. And when they say this guy hang out with a girl, they always confused why how it can happen, because this guy have like a the gender expression in the feminine way, so it's always confuse them, and they always discuss about this. So but right now, since we add up those knowledge about LGBT more in our curriculum, so they more understand about this, but I'm going to talk about this later. And I'm gonna say that gender, all dimension that I say, except the biological sex, can change all the time. We call the gender fluidity. So it means you can change your gender identity based on what you think. You can change your sexual orientation, and it's mostly happen with the girl. For example, like my friends, once they broke up with the boyfriends, right? And they belong to another girlfriend, and they feel like they feel attached to each other. So at that time, they can change to be like they fall in love with the same sex, and then it can switch again. So this is a gender fluidity. And the important thing I want to tell to everyone, at the same time when I teach my students, sexual and gender diversity is not abnormality. It's just a natural way, and it can change. It doesn't cause anything, but the problem that happen is come from society, that they do not accept these differences, you know. So, and LGBT are the member of every community. So in the global issue, you know that we have the gender and sexual norm, right? People should belong to the opposites, should fall in love in the opposite sex, and should feel like the same gender as you born as a biological sex. So that's create a gender norm. However, these LGBT people, they are not doing wrong, but their gender and sexual are different from the gender norm. So that's why they receive a lot of negative attitude, or we call that stigmatization from the society. And that's create a lot of health issue, right? Based on the research, especially in the US almost 20 years ago, it's confirmed that LGBT population are more likely to be a high risk for physical and mental health disparity compared to those heterosexual and cisgender counterpart. For example, like a depression and suicide is higher 3 to 10 times compared to general population. Not only mental health issue, also physical health issue too. For example, lung cancer, or like a cervical cancer, or hypertension, or DM. How about Thailand? I give you the overview of the issue in the global issue, in the global view. But in Thailand, I think you may feel like Thailand is a friendly country for LGBT population, right? We have a lot of lady boys show. We have a lot of like a gay pride, and also the club or bar for LGBT. But I think the thing that you see is just in Bangkok, right? Or a big city that we say that is a place for tourists. But how about others? This thing I'm gonna show you what's gonna happen in the overview of Thailand. So in Thailand, we used to breed that people as a mental psychiatric disorder. So, and we removed that out from the diagnosis, like since 2002. At that time, LGBT have to hide themselves because they get a lot of stigmatization from the society. After remove that from the DSM-4, the stigmatization still be there, and it cannot change easily until now. Even though today the Thailand try to promote the country, like the tourism authority try to promote the image of Thailand like a gay paradise, or welcome the LGBT to travel into Thailand. But the fact is, we do not have LGBT specific law to support LGBT people. We cannot marry, right, with the same sex. We cannot. So the law, like a life partnership bills, still in the process of reviewing, and the government reject twice. We try to propose again, but it doesn't work yet. Let's see what's gonna happen in the future. So, and all biological male are required to serve in military, and they cannot change their ID card, right? They cannot change their second gender in the title in their card. So based on the law, all Thai people are men. They have to serve in the military. However, once those LGBT or especially trans women, right, because they're born and their names, their titles still be Mr., they have to go to recruit for the military. But they don't want, because that is not the way that they want. They have to meet with the doctor and get the not like a certificate, the letter, like the document to that specify that they have a gender identity disorder, and show that to the military, because to avoid from recruitment in the military system. You understand what I mean? So that's why it's to be a problem that all transgender in Thailand have to get that the document, the letter, to show the military that they have a gender identity disorder, to prevent them or avoid for serving in the military. How about the social and culture? We still have a lack of understanding about the needs for LGBT people, because we do not know well about LGBT knowledge. And the most challenging is they always get the rejection from their family, right? Because Thailand, our culture, most of us receive some belief from Chinese people, because Thailand, most of Thai people quite like a Chinese people, and in China, in Chinese belief, they always think the man have to marry with the woman. So once they know, or if they know their son or their are LGBT or gay and do not marry, they always get the rejection from their family members. So even though LGBT may not have a lot of rejection visibly, but in fact, if those LGBT people do something wrong, for example, if they stole something, if they act out something inappropriately, they can get the social stigmatization very hard from the society. Yeah, but if you perform well, you can take care of your family well. If you out and you behave appropriate well, it can be tolerated at some point, right? So how about the religions? Religions is very important for Thai people. We are Buddhism, and our religions believe that the people who born as LGBT has a sin from past life, or they lack of ability to control their sexual impulse or tendency. So that's why they have to born in this life as LGBT, because of your sin. You do something wrong, right? And also some part of Thailand, in the southern part of Thailand, we close to the Islam religion. And you know that in that culture, Muslim, they do not accept LGBT at all, right? So that is another problem. And how about employ and housing? We got a lot of social discrimination from the society regarding looking for the job or promoting. We have a lot of news during the past year that people who are transgender and apply to be a teacher in school was rejected from job application, or some may not get the promotion because of their gender preference or gender expression. And that is quite a little bit sad because we have a lot of transgender or lady boy in Thailand. Sometimes we call lady boys, right? Because they dress up like a woman. And if you interested in this topic, you're gonna see that most of transgender in Thailand work in a specific job, right? For example, a lady boy who like a show, right, in the bar or like a nightclub, or like a work in the entertainment field, right? Like a dress up hair maker, something like that. They cannot do something else much. So that's why you do not see we have a lecturer like a transgender. You do not see that much, right? Because that is the view of the society, that they limit that transgender should do just only that job. Okay. And same-sex couples, they cannot marry together. So that's why they do not have the rights in their life once they belong or they stay together. How about the education and young people? I remember before I went to the US for my PhD, we do not know about LGBT. I learned a lot from professor at UIC, and I learned that, and I surprised that you include this kind of knowledge in the curriculum. Once I came back to Thailand, we start talking about this, but unfortunately at that time we do not have any course that link to the LGBT knowledge. After that, we try to build this up, and it still have more, and it is starting have more and more. So luckily that I feel like okay, at this time Thai people open more about LGBT because you include this knowledge in the nursing curriculum or also in the school. But before that we do not have, right? And we also have a student uniform. If you come to Thailand, you're gonna see students always have to dress up properly based on their biological sex, right? That is can create the feeling of the people who are trans or LGBT as well. And we have an interesting research result like last 3 or 4 years that they say that even though the young generation of Thai people still believe being LGBT is wrong. Before that, I believe that the young generation they should have like a open mind, right, for this thing. But this research show like this is interesting, and they may need to an advanced research to explore more on this issue in the future. How about health and well-being? As I mentioned in the past, they has classified as a permanent mental disorder. And I think it's the same issue in the US. Those LGBT people cannot access to health care well due to the social stigmatization. Even though we have a lot of sex reassigned surgery, because people from like a trans people from other country go to Thailand for get the surgery because it's very cheap, but we still cannot change the legal document to like a cross gender. And most research in Thailand do not support LGBT health study well, especially in the past, but right now the trend is changed. Okay, and discrimination stigma toward LGBT person in health system has also been reported. It still be reported until today. About the family and society, LGBT live in society with strong pressure to be a good citizen. As I mentioned, you have to be behave, to be a good son or daughter of their family. If you can fulfill that family needs, if you can serve, you can take care of your parents well, you are okay. But if you cannot, or you do something wrong, you're gonna get a lot of discrimination from the family member and also from the society. How about the media and technology? It's quite sad in the past that most of Thai media generally show or present LGBT in a negative way. They are like a show in like a in the comic relief or like a sexual way in the TV or series, which is create a negative picture for all LGBT. But right now it's little bit it gradually changed as well. A lack of an official media exists in report or on incident of harassment, discrimination, and violence toward LGBT population. They always say like a gay kill someone. So this kind of the word in the media can portray that LGBT people always do something wrong. But if LGBT people do something good, they do not show much in the media. You know what I mean? So that's why it creates something like not fair enough for LGBT people. So based on the thing that I show you, you can see that in Thailand, LGBT people still face with a lot of hard situation, and they always have to fight with the social discrimination until today. And that is why they have high rates of health disparity as well. The way that we try to describe why LGBT people have high rates of the health disparity is can explained by the minority stress model. The minority stress model created in 2003 by Mayer. He used a meta-analysis from the research around the world, and he found that the minority stress is a relationship between the minority and dominant value, right? Because they say that the people in the gender norm are the dominant group, but the people who are not belong to that gender norm are the minority group. And always people in the minority group almost always get the pressure or stigmatization from that dominant group. But the interesting thing about the minority stress is he said that the minority stress is a unique stress for LGBT people only, and it's chronic. It's happened all the time for a long time, and it's linked to society. Because by themselves they do not feel anything, because LGBT is nothing wrong, right? But since social give the pressure to them, so that's why it's linked to the society. This is the minority stress model by Mayer. You can see they have a lot of construct under the model, right? And the outcomes, the final of the model is about mental health outcome. This can be in positive way or negative way, but let's see. I try to highlight it to make it easy to see, right? And you can see that the color that I try to highlight, I separate into 4 boxes or 4 construct. The first one is about background of the people. The second one is about the stressor. So that background can create this stressor, right? But we also have buffer, like a social support or coping mechanism to help LGBT people, or maybe to make it more stronger, those stressor path once they impact to the mental health outcome. So let's talk a little bit about each one real quick. So the circumstance in environment is about the all situation in your daily life, right? And you always have a minority status, right? And minority identity in each of you that can be a background factors for everyone. But it's not only this so sexual and gender identity is also linked to other demographic or background, for example, education, right? Or like a level of income, something like that. Those background or personal characteristics can link to the stressor, right? Based on the background, you can have a stressor that we call general stress, which is happen from your daily life, right? It's not related to your sex or gender, but it can be like a economic issue that can create the general stress. It can be about the politics that create the general stress, But that is not enough. LGBT people have specific stress that we can call a minority stress that add up because you have the LGBT identity. And the minority stress can divide into two big groups. We call a distal or proximal, right? For the distal, what is the distal stress? It includes discrimination and prejudice event. So basically, it's come from society. So that's why we call it a distal stress, right? You receive that from the society, from other people around you who see you as an LGBT. And another group of minority stress is proximal stress. What is that? Concealment, expectation of rejection, and also internalized homophobia. We can see that this factor is come from yourself because you feel that you are LGBT, you scared that you have to open to someone. So you scared that if you go to the society, someone gonna reject you, do not accept you, and you feel that as I born as LGBT, why is me? Why? So I feel like I hate myself that I'm born as LGBT. So you see that this distal and proximal stress is linked to your LGBT identity. And no one know except you, right? Because sometimes you go to shopping, something like that, and people react to you. They may not know that you get stress from them based on the minority stress. So that's why minority stress is specifically to LGBT population that general population may not know. This LGBT get a lot of impact from the thing that you treat them. And the buffer, like I think it look like the stress theory. We also have the coping style, social support that try to emulate or maybe make the stressor more stronger or weaker, right? And the final is health outcome. So the mental health outcome can be in a positive way or also a negative way as well. If you do not get a lot of social discrimination, if you have good social support as a buffer, you may have positive health outcome. But if you cannot open to someone, you hate yourself much because you are LGBT, no one know you are LGBT, I cannot talk about this with anyone, you may have a negative mental health outcome, right? So in Thailand, people about 5% are LGBT, and they also report the high level of social discrimination. So, and the thing that happened in Thailand, we do not have a lot of knowledge on this, and we still have a lot gap of knowledge. So the study in LGBT collect in the small sample size or in the Bangkok only, so we do not have a standard measure. We do not use a conceptual framework before. So that's why I conduct the research in my PhD training. I translate a lot of LGBT measure to capture those minority stress, right? Because I want to use the minority stress, and I also apply this minority stress model in my research at that time. I collect data using a cross-sectional study to study the mental health among Thai LGBT population and use the minority stress model guide my research. I collect data and recruit the participant using a variety of strategy, convenience and snowball sampling, collect data online and in person by working with the LGBT organization in Thailand at that time. And I want to show you the result. The result is very interesting, and you can compare with the study in the US. In Thailand, almost 60% they have stress, and 40% have moderate to severe loneliness and depression, and almost 40% having a lifetime suicidal ideation, which is quite high. 90%, almost 20% have passed 12-month suicidal ideation, and 13% have suicide attempt. Interesting, right now I conducting a research project with my colleagues using the minority stress model, but in the adolescents. The result is very interesting. 80% have suicidal ideation among our LGBT adolescent. But I didn't publish that yet. We just know that result very interesting. So I think we have many room to study more about LGBT issue in Thailand before we're gonna create the intervention, because it's a lot of factors that we need to know. So the cause of depression linked to many things, linked to the personal information, also linked to the high health risk behavior, and also linked to the minority stress model, which is a concealment and social discrimination. For the lifetime suicidal ideation or 12-month suicidal ideation, the cause of it linked to the chronic disease, stress, loneliness, and also social discrimination. So social discrimination is quite important to create those depression and suicidal ideation. Also, 12-month suicidal ideation linked to the smoking, stress, loneliness, and victimization. About the suicidal ideation. How about suicide attempt? Little bit change, little bit difference. It's linked to the poverty area. It's linked to the poor health status. It's linked to the alcohol use, which is makes sense. It's linked to the you have a chronic disease, physical chronic disease, and it's linked to the level that you hate yourself, internalized homophobia. Okay. So the result can indicate that those mental health issues linked to the minorities stressor, but it's mixed, not just specific in some factors. The pattern is varies based on the outcome, and also the level of stress, loneliness were the strongest predictor of depression, lifetime suicidal ideation, and 12-month suicidal ideation. I also check for the mediation of the pathway of this minority stress using the coping mechanism as a moderator. And I also see that problem-focused coping was a protective factor for depression, and avoidance coping was a risk factor that make the level of stress more stronger for the depression outcome. So what we're gonna move next is still be something that we need support, and we have to work more for know more about the health disparity and social equality among LGBT in Thailand. The thing that we try to make the change for society right now, first we want to have the same-sex marriage or life partnership bill as in the US, because research show a lot in the US, in the state that you can marry, the mental health issue is decreased, suicide decreased. But the state that or the country that do not have the same-sex marriage still have high level of mental health issue among LGBT. And we want to make a health equity for Thai LGBT, because we cannot access to healthcare well. The nurse, the doctor don't have enough knowledge to take care LGBT people, right? We want to have the rule or regulation to protect us, no discriminatory, no rejection, right? We want to add up more about LGBT knowledge and issue and needs in the curriculum, especially healthcare, because we do not have that much and people do not understand well. We want to remove the limitation for the blood donor who are especially gay and bi, because right now, if you go to the blood donation and they're gonna screen you, if you are gay or if you are bi, they may reject you. They do not accept but right now it's quietly changed. They ask about the sexual behavior more than ask about your gender identity. Okay, we want to create the neutral atmosphere, like a uniform restroom. We want to have more space for LGBT population, and we want to gain a skill for Thai community to understand us more. And I hope if we can do all of this, it can reduce those health disparity among LGBT population in Thailand, as well as maybe in the US as well, right? And we try to follow to the guideline that your country used, because our knowledge still behind you a little bit. So this is what we have about LGBT situation in the past, what we are doing, and what future direction that we're gonna go. So thank you so much, Dr. Crystal.